Hello, my name is Cade Walker. I am the section manager for the policy rules and compliance here at the Healthcare Authority with the Employee Retiree Benefits Division. I'm here to present on the legislative report on the consolidation of the PEBB and SEBB programs. This recording is being done for the meeting for July 18th, 2024, and should take about a half an hour. So we're going to hop right into it. In 2024, in the supplemental budget, the Washington State Legislature tasked the Healthcare Authority with writing a report about the consolidation of the future consolidation of PEBB and SEBB programs. In that, looking at the report of consolidation, it kind of first starts with let's go back and do a history of consolidation reports. Consolidation of benefit purchasing has been a long-standing topic that has been looked at through about 10, if not maybe more, reports since the late 1980s, with the most recent being published in 2020, and then going backwards from there. I think it's worth noting that the majority of the reports on consolidation stemming back to 1980s were focused on the consolidation of the benefit purchasing for K-12 schools. The legislature in 1993 did pass legislation to consolidate the purchasing of K-12 benefits, though that effort was abandoned the subsequent year, which is what resulted in the retirees from K-12 being part of the PEBB program. But it wasn't until later in the 21st century, with the report from 2012, when there started to be some consideration about the creation of a standalone program for the K-12 purchasing, or considering it being consolidated in with the PEBB program. Then subsequently in 2017, with the passage of 2242, also known as the McCleary Fix, that the SEBB program was created, which consolidated all the purchasing of K-12. And that program was implemented for health plan year 2020. And so we're now in its fourth year since it's been implemented. Since then, there's been two reports that were done that looked at the consolidation of the PEBB and SEBB programs in some way, shape, or form. Again, with the most recent being in 2020, they looked at some of the cost advantages and administrative advantages that would come about if there was a consolidation between the PEBB and SEBB programs. So this report, in kind of taking the next step from that report in 2020, the legislative request on this report focused on four areas of consolidation. First, it asks us to conceptualize a single governing board structure. Second, to create a single risk pool for active employees and non-Medicare retirees. Third, maintaining the current eligibility for all active employees. And fourth, having a single portfolio of benefits. This report is due to the legislature December 1st, 2024, so a fairly short runway for us to complete the report and have it reviewed into the legislature. The report does ask for our insights and analysis, but importantly, it doesn't ask for any particular recommendations. Much of what the report is asking for is just to articulate what that would look like, what consolidation of risk pools or the board structure might look like, coming up with some options of what that might entail, and then providing what other insights we have regarding maintaining eligibility or single portfolio of benefits. And then additionally, the legislative ask for us has been that we provide statutory language that would achieve what is being asked for in the report in creating the single program for the consolidation of PEBB and SEBB programs. Additionally, the legislature had some considerations they wanted us to include in the report, or just to keep in mind as we're doing the report. First, and I think one of the most important parts was us to engage, the Healthcare Authority to engage with the impacted participants of the PEBB and SEBB programs. That is what we are doing here today. I'm engaging with a stakeholder population to present what we have, the information that we've been able to put together so far for our report, talking about some of the structures and frameworks and the preliminary insights that we have. And then we'll be able to collect feedback, and we'll incorporate feedback into our report that is due on the 1st of December. Also, kind of doubling up again on the importance of maintaining eligibility for the current participants. Third, ensuring equity, making sure that we are applying an equity lens to the work of consolidation. And last is to consider consolidation reports that have done previously. And in that previous slide, you noted there was about 10 reports, and we're certainly making sure that we're cognizant of what those reports have listed, though a lot of them are outdated now with the creation of the SEBB program. Certainly, we have a lot of reliance on the report that was done in 2020, where a lot of what was stated in that report still holds true. And some of it is no longer quite as we would expect because of the 4 years now that we've had the SEBB program in operation and some of the experience we've been able to pull forward from that to change some of the assumptions that were made in that report. So with that, we'll move on to the insights that we have and the suggestions, some of the insights we have on the single governing structure and how that board might look. So let's first talk about the current board structures for the PEBB and SEBB program. Both of the boards are chaired by the director or the director's designee of the healthcare authority. And then there are a set of benefits management and cost containment on the PEBB board. There's 5 of them listed, 4 of them are voting, and a fifth one, there's 3 that are voting and 4 that is a fourth that is a non-voting member. And then we have a representative for state employees, a board member representing the state retirees, and a board member representing the school district retirees. Again, if you recall, I was mentioning that back in 1993, after the attempted consolidation of K-12 that had started, when they canceled that, the retirees from K-12, it was decided it made sense for the retirees to continue to receive benefits through the PEBB program. And they've been, when someone retires from K-12 and is eligible for retiree benefits, they are eligible for PEBB retiree benefits. That has been in place since 1994. On the SEBB side, a little bit of a different structure, at least a little bit larger in terms of voting number. They have the 5 voting members of what are referred to as health benefit policy and administrative, which serve a very similar function to the benefits management and cost containment members. There is 2 board members representing certificated employees and 2 representatives representing classified employees. And for those who are unaware, in the K-12 system, those are the classified and certificated employees are kind of the 2 largest buckets of employees that we can group them into. Certificated being those most commonly thought of as teachers, but any profession in the K-12 system that requires a certification, again, teachers being the most predominant there, but it could include other types as well, teacher librarians or some administrators that require, principals might have certifications, others. So that kind of is representative of those populations. The classified employees are those that essentially don't require certification, include the vast majority of other employee types. That would be para-educators, bus drivers, lunch workers, administrators, secretaries. The list covers a broad array of different employees who are in the classified sector. And they're pretty well evenly split in K-12 system of the about 135,000 employees. It's fairly well split evenly between certificated and classified employees. Also, I do want to note on here, you see under row 5, there's health benefits policy and administration. There's the WASBO designation underneath it. That's because in statute for one of the positions of the health benefits and policy administrative board members is to be a representative of the association representing school businesses. In Washington State, that is the Washington Association of School Business Officials. And so they have a board member position specifically representing from their organization that serves as one of the health benefits policy and administration board members. Just briefly, for those of interest, the statutes that create the PEBB and SEBB programs are listed here in RCW 4105-055 for the PEBB board and RCW 4105-740 for the SEBB board. A few insights as I shared previously. When you look at the previous slide and you see the construction, you'll note that there's an equal number of the board positions that represent the covered populations, whether those are state employees, retirees, or K-12 employees, and then the health policy, cost containment, and administration type positions for the board, and there's an equal number. On the SEBB board, there was 4 of those health policy representative positions and 4 positions representing the employees that are covered under the SEBB program. And on the PEBB side, there's 3 board positions that are voting that represent the health policy and cost containment, and 3 representatives for the state employee, retirees, and of the K-12 and state systems. And for both of them, as noted, the healthcare director or their designee serves as the chair and is an additional voting member. So when we look at what a consolidated board might look like, we've been careful to make sure that we're not taking merely the SEBB program and merging it in with the PEBB program. We really are trying to consider what a new program would look like rather than having one program just consume the other program. Even though the PEBB program has been around for many decades and the SEBB program was went live in 2020. So when looking at some of the options that are available for the board structure, we came up with three models based on some populations and looking at other boards that exist under the executive branch under the governor's jurisdiction, of which there's approximately 260 boards under the governor's jurisdiction. We came up with three models that we refer to as the proportional model, an equal model, or a combined model. And we'll go into a little bit more, we'll illustrate those on the next slide. But first, I want to talk a little bit about the enrollment of membership in the different programs as a way of kind of justify or rationalizing the proportional model that we have on the next slide. You can see here on the right side of the screen, there is the breakdown of the populations. Now, this is the covered populations that have medical plans through either the PEBB or SEBB programs, broken down by the three main groups of populations that are served by the programs, that being the active PEBB population, or the people who are active employees in state or higher education. Then you have the SEBB program participants, which are the employees of schools and educational services or charter schools, and then the retirees from either the PEBB or SEBB programs or the K-12 or state systems. And you can see that in general, subscribers being just those who are the primary account holder, and the total members being the account holders plus any dependents they have on the account. And you can see a roughly 2 to 1 ratio between the PEBB and SEBB populations and the retiree populations, which you'll see why that was germane for the next slide. So here's the three kind of options we looked at. Now, of course, this is just three options that we've conceptualized that seem to would work well for a consolidated board. But there are certainly other options that could be available in different structures. These are just three that we're putting out there for consideration. Following suit with the insights that we had from the existing boards, the assumption being that the chair of any of the boards would be the healthcare director or the healthcare director's designee. And also that the number of representatives that represent the populations that are served would be equally balanced by the number of positions that represent the benefit policy or cost containment or administration type positions, which explains why the next row on these all of these boards has either 5, 6, or 7 of those particular positions, which is meant to equally balance the positions for those other board member types. So under a proportional representation, that is referencing back to the populations where there's a 2 to 1 ratio, that we would include 2 state employee representatives, 2 school employee representatives, and 1 retiree representative, again, mirroring the proportionality of the populations that are served by the current PEBB and SEBB programs. Then we have the equal representation, which adds an additional retiree to say for all 3 of the populations, we'll let them all have 2. They will have 2 representatives for each of those respective populations, which adds an additional retiree and also causes an additional benefits policy and cost containment position to be added. And then last would be fundamentally just a combination, taking the existing board members the existing board member types and merging them into a single board. You can see here having the 1 state employee representative, 1 retiree for the state retirees, 1 representative for K-12 retirees, 2 for certificated school employees, and 2 for classified school employees. Now, note in the first 2 structures of proportional representation, equal representation, we didn't note any other specification for the representation for state or school employees. It's assumed that it would follow suit, and at least for the school employees, there would be 1 certificated board member representing certificated employees and 1 who would be representing classified employees. When we look at the equal representation model with retirees, we would assume as well that the retirees would have 1 retiree representing state employees who have retired and 1 representing K-12 employees that have retired. As far as state employees go, we don't have a necessary assumption about where they might, what populations might be different that they represent, given that currently under the PEBB board, the state employee representative represents all state employees that are under the PEBB program. Although we could, if we were to think about and make any recommendation or suggestion to the legislature if they choose to move forward, that for state employees, it's possible that maybe there is a representative for higher education and one that's for the state agencies. Would be one possible way of saying. Otherwise, just having it more high level was the intent of just showing some of the structures. Of course, the recommendation or the suggestions that we might have and additional considerations of what those board members could be and how they represent will be included in our final report. Additionally, there is the possibility that the benefits policy and cost containment positions also have some additional requirements in who they are and what interests they represent. For instance, we could carry forward one of the representatives for a WASBO member, one of the school business officials being one of those benefits policy and cost containment. Similarly, we could have positions that represent an emphasis on health equity or DEI or someone from Department of Retirement Systems, given the retirees that we have in our population and some of the logistics that we have with the Department of Retirement Systems for our programs. So there's different options that go down into it as far as the specifics of the board members and what particular areas of interest and expertise they might represent that we'll be including in our final report. Merely just wanted to show some of the structures so that people have an idea of the type of structures of boards that we're going to be putting forward in that report. So with that, we'll move on to the task of creating a single risk pool for the active and non-Medicare retirees. So when we're talking about risk pools, for those who aren't aware, risk pools is an insurance industry concept where you take the relative risk for a certain population, you pool it together so that shared risk is able to cover the populations, which is the kind of the basis of insurance in the first place. So for the pools that we have under the current PEBB and SEBB programs, there are three that are currently statutorily defined. First is the PEBB program's non-Medicare risk pool, also known as the active risk pool. This includes the population of all state employees and other employees. It includes state and other non-Medicare retirees, and it includes non-Medicare school retirees. This is a particular interest because the benefits that are offered are determined, or the rates for those benefits are determined by the risk pooling of the populations. And because we have a Medicare portfolio and a non-Medicare portfolio, when certain members who have retired from state service, who meet eligibility for certain DRS plans that have met other qualifications for retiree benefits, and if they've not reached Medicare age yet, they're able to retire and receive benefits through the PEBB program, and they're put into the non-Medicare risk pool and are able to have the benefits that are available to all the non-Medicare individuals in that risk pool. And then when they become Medicare eligible, they move from the non-Medicare risk pool to the Medicare risk pool, and then they have access to the Medicare portfolio of benefits that are available. That then leads to the second risk pool, which is the PEBB program Medicare risk pool, which includes the state and other employee retirees and Medicare school retirees, all of whom are eligible for Medicare and remain in that pool. Then on the SEBB program, there's the school employees, and that includes, again, as mentioned before, all the school district, educational service districts, and the charter school employees. It does also include other employees, which we'll speak about in a moment when we get into the eligibility framework. But for now, I think that just the structure of the risk pools is a little bit more important for this particular conversation. So the legislative ask was very specific in identifying that they wanted to consolidate the two active / non-Medicare retiree risk pools. They identified those very specifically, but also it was important to note that there was no changes or anything that would be made to the Medicare risk pool. It would be remained as it is, as it would for the Medicare portfolio of benefits. So there's not anything that we are doing that would change anything in the Medicare program, except for that it would now be under the jurisdiction of the consolidated board, whatever structure that is, that risk pool and the portfolio would also be under the jurisdiction of the new consolidated board. So in looking what the risk pools would be after consolidation, based on what the legislature asked us to do, because in theory, the legislature could consolidate the programs and still maintain a alternate risk pool. They could have two risk pools under the same program that are for the active non-Medicare retiree, the active employees and non-Medicare retirees. But they specifically asked us to have a single risk pool, consolidating all of the state and other employees, the school employees, and then the non-Medicare state and school and other retirees, and then maintaining again that Medicare risk pool for state and other Medicare retirees as well as K-12 school retirees. Moving on, eligibility. This is one where I think it's apparent that with the ask of the legislature to maintain all current existing eligibility, both in the specific ask and then as well as in the additional considerations, it's something that is obviously very important that we're careful about making sure that we consolidate all of the eligibility requirements into a format that does not do anything to change up that eligibility to make it worse for anybody or remove any eligibility or even expand eligibility unintentionally. So with that, let's take just a quick look at the current eligibility. As we look through the PEBB and SEBB program eligibility, there's really three different categories of populations of which there's eligibility for. The first would be the eligibility for the PEBB program employees. And this includes, by definition, the employees of all of the state, including the employees in higher education, the elected or that are in the public, really I should distinguish it's the public higher education institutions, the elected and appointed officials of the executive branch, all of the judges from the superior, appellate, and all the way up to the Supreme Court for the state of Washington. And it includes all the members of the state legislature and the employees of employer groups. Now, employer groups, this is where I want to spell out a little bit more about what employer groups are, different from the rest of the definition of a program employees for PEBB. Employer groups are entities that are permitted under contract to purchase benefits through the PEBB or the SEBB program. Those entities include other public municipalities like cities or county governments. It includes water districts, fire districts, fire departments, police departments. It includes tribal schools. It includes the health benefits exchange. It includes a large number of articulated entities listed in statute under the definitions under 4105.011 sub 6A that are permitted by statute to contract with PEBB to purchase benefits. This is an important distinguishment because all the other categories of employee types listed before are required to have their benefits purchased through the PEBB program. Any of the state agencies or the legislature, they're not permitted to go out on their own to purchase benefits for their employees. They are required by statute to utilize the benefit purchasing of the PEBB program. And that's different for the employer groups. They have a permissibility. They're allowed to come in and purchase benefits, and they're allowed to leave if they so choose. And currently, I believe there's approximately 600 or so different employer groups throughout the state that purchase benefits through the PEBB program. And in last year, the employer group allowance for having the ability to contract with the program, that concept was mirrored for the SEBB program. And so the SEBB program employees, which include school district employees, employees of educational service districts and charter schools, they created a new definition for employer groups for what we refer to as SEBB program employer groups, which is a much smaller defined list. It just includes the employees of tribal schools. It includes the employees of unions or labor organizations that represent school employees, and it includes school directors. So school directors on their own are able to come and purchase benefits through the SEBB program while they are in office. And then there's a last group of category of employees, or not employees, but other subscriber types that are permitted to purchase benefits through the PEBB program. And that is the retired, disabled, or separated employees. Separate employees have a little bit of a stranger definition. They're technically retired, but they are not yet Medicare eligible. So they're able to participate again in that active non-Medicare risk pool under certain conditions, meaning which those conditions are related to what DRS retirement plan they are part of, whether it's a plan 2 or plan 3 in the PERS, CERS, or TERS categories. And they've met certain vesting, and they've put in enough years with this state or the school district that they're able to be a separated employee. So those are the 3 categories. And just for reference for those policy wonks that want to get in and go see the statutes, the rules, I think it's important for us to note here that not only is there a lot of statutory requirements for eligibility, but there's a significant amount of rules requirements for eligibility as well. Now, this is important because the statute and the statutory eligibility is set by the legislature. The legislature has very specifically set out a certain threshold for eligibility in both the PEBB, SEBB, and the retiree populations. And then they delegate to the PEBB and SEBB board, respectively, to create the terms and conditions and further qualifiers that do not go any further in restricting eligibility than based on what the legislature has put forward, but does allow them the opportunity to expand eligibility beyond what is said based on funding or other parameters. And so for the PEBB program, SEBB program, and the population of retired, disabled, separated employees, here you can see the specific statutes that contain the legislatively required eligibility frameworks, and then the rules that are propagated by our program through direction of the boards through resolutions for the rules for all 3 of those categories that exist currently. So what would consolidated eligibility look like? Well, in thinking about merging all of those statutes into a single board and then a framework that works for all that to maintain the current eligibility, we decided to do a little bit of shifting of those populations. That's where the conversation about the employer groups becomes important, because what we did is maintain 3 separate populations in which the eligibility framework would be applied and be able to shift all the eligibility to, with the exception for those employer groups. So instead of having the PEBB population, we would now refer to them solely as the state employees. And that would consist of all of the state employees, including higher education, the elected appointed officials of the executive branch, the justices of the Supreme Court, Appellate Court, and the Superior Court, and the members of the state legislature. And you'll note that we don't include that list of employer groups in this section. Then we'd also have the population of school employees, which would include just the employees of school districts, educational service districts, and charter schools, again, removing those employer groups, which then would become part of the 3rd category, which we would call the other eligible subscribers. And this is where all of the participants in programs that are optional to participate, that they choose to participate or not, or their employer chooses to participate or not. And that would include the separate employees, as previously discussed. Again, they have the ability to choose to enroll or not. The retired or disabled public and school employees and their dependents, the surviving dependents of public school employees, surviving dependents of emergency personnel killed in line of duty, formerly elected or appointed officials and legislators, school board members, employer groups, as discussed earlier, and retirees from formerly participating employer groups. And again, these are all participants who are eligible through contract or through permissibility to participate in PEBB or SEBB benefits. And so under a consolidated program, grouping them together, having their eligibility grouped together, both in the rules and in the statutes, creates a framework that allows us to preserve all that existing eligibility. So, which is important because that gets us to what would not change. And based on this structure, in our understanding of having reviewed and being, we're the experts on that. We feel that this would not change up any of the eligibility. It would not change up, some of the examples is that it would not change up any of the hour requirements unique to any of the employee categories. For instance, the SEBB program, they have a 630-hour requirement for eligibility for their benefits, which is unique for their program. By structuring it by having a defined population of school employees that eligibility applies to, and that does not apply to state employees, we ensure that there's not that inadvertent crossover of eligibility. Other such examples are the eligibility determinations that are required to occur at the start of every school year for school employees. The 8-hour maintenance rule for state employees would continue to apply only to that subset of state employees. The faculty averaging would continue to only apply to the higher education institutions in the state employee category. And the seasonal worker eligibility would continue to apply only to a subset of state employees. Moving on to the last area is a creation of a single portfolio of benefits. So let's briefly go over what is the current benefits that are offered through the PEBB and SEBB programs, not taking into consideration the Medicare options, because again, that would just carry forward into the consolidated program without any changes to it. But we have the PEBB and SEBB programs, and there are some differences between the benefits offered, and we're going to highlight some of the differences here, the current differences that exist. On the medical side, there for PEBB, again, this is for the non-Medicare or the active risk pool. There are 3 carriers that offer a total of 10 plans. And while on the SEBB side, there are 7 carriers that offer a total, there's 5 carriers that offer a total of 17 plans. Now, not all of these plans are available in all counties in this state. Some have a lot more plans available and some have a lot less plans available. But in total, the PEBB program offers 10 different plans and the SEBB program has 17 plans. The dental plans, the network and number of plans that are offered are the same. There's 3 networks offering a plan each. The Uniform Dental Plan, which is our self-insured product. Then we have a Delta Care and Willamette. And then all 3 of those plans are available to all the employees in the state, as well as those networks and plans are available in both of the programs. Beginning in 2025, for the vision plan, it will be the same carriers and the same number of plans available, although currently, and it has been historically in the PEBB program, vision was embedded within the medical benefit. That is changing for 2025 and is leveraging the existing contracts on SEBB to offer the same vision carriers and plans to the PEBB population. So in 2025, there's a alignment already of the vision plans that are being offered, even though that's not necessarily the case today. Then there is the same carrier and plan for both the MetLife. MetLife as the carrier for the life and AD&D product for the PEBB and SEBB programs. And then for the long-term disability or LTD, it's the standard is the carrier. And there's an offer of both basic and supplemental for both the PEBB and SEBB programs, which is the same, a basic and supplemental product for the life and AD&D. The basic plan option being what the state covers. There's a mandatory state option that is purchased on behalf of employees, and then the employees have the ability to sign up for a supplemental coverage in either the life, AD&D, or LTD option in both of the programs. So looking at a little bit of the numbers, premiums kind of matter. The premiums before employees, aside from the supplemental life, AD&D, and LTD, the only other premiums that the employee would pay is for the medical. Dental and vision is covered at 100% by the employer. So it's just the premium for the medical portion that is the responsibility of the employees. So when we look at employee premiums in the PEBB program, we have a range here. The split is on the first part is the split is for the individual coverage up to a full family coverage. And so you see here the range from $26 up to $331 for individual coverage, or $72 up to $910 for full family coverage. Now, there are other tiers in between there. We're just doing the high and low of those tiers. In the SEBB program, fairly similar. There's a $21 to $237 range for the individual premiums, or $63 and $711 for the full family. The deductibles are identical. The maximum and minimum deductibles, again, there's a lot of different plans. We're just highlighting the high and low within the plans that are available. So the plans in the PEBB program and the SEBB program both have the same high and low deductible for their plans. Again, similar to the out-of-pocket maximum, and this is the maximum annual out-of-pocket that would be paid after deductibles met and the co-insurances are paid. Very similar with this slight difference, a little bit higher on the top end on one of the PEBB plans than on the SEBB plans. And then you have the co-insurance, which is the amount that's paid after the deductibles met, where the plan pays the majority 80 to 90% on the PEBB program, and the PEBB and the SEBB side, the plan pays between 70 and 90%, which means that the employee pays either 10 or 20% on the PEBB, and the employee pays either 10 to 30% on the SEBB side, again, depending on what program or what plan you've been enrolled in. So a little bit more of the differences of the actual benefits themselves. Without going into the specifics on medical, we covered some of the financial differences on them, and it's fair to say that depending on the plan, there are differences. There's different networks. There's there's some differences in some of the benefits under certain plans, more physical therapy, PT, ST, OT, physical therapy. I forget what ST and occupational therapy. Some of the therapies that are available are a little bit more have a little bit better coverage on some of the SEBB plans and in PEBB world, but really there's so many different plans and variations that it's really hard to compare much. It's more the financials that you compare differently and some of the network availability. But when we look at dental, the Delta Care and Willamette plans between the PEBB and SEBB programs are identical. The coverages and everything there are identical. Now, however, there is some differences in the uniform dental plan between the PEBB and SEBB programs. And that came about because as a result of bargaining, where on the SEBB side, the SEBB Healthcare Coalition bargained for a little bit additional monies, and the legislature assigned that additional increase to certain benefits in the uniform dental plan to enhance the dental benefit after bargaining. And those additional enhancements in the uniform dental plan for the SEBB program include waived deductible for children up to age 15, increased plan coverage for crowns, the use of composite fillings for posterior teeth instead of amalgam, and an increased benefit for non-surgical treatment of temporomandibular joint disorder. And so that is there's a difference there where there's an enhanced benefit on the PEBB uniform dental plan side than there is for the PEBB uniform dental plan. The vision plans for 2024, as mentioned, those are identical. The coverages are the same. And again, the cost is the same to the employee, which is say there's no cost to the employee, which is the same on dental. And then the life insurance AD&D, those are identical coverages between the PEBB and SEBB program. And the long-term disability is largely the same, although there is a couple of differences that are worth highlighting. First is that while the optional supplemental coverage is the same, there is tiering there's age band tiering for costs on one of the programs than it is for the other, where it's a blanket amount for it for long-term disability. And then the basic benefit, there is, which again, basic benefit being employer paid, there's a bit of a difference in the total benefit. Where on the PEBB side, there's a $240 monthly maximum benefit, and the SEBB side, it's a $400 monthly maximum benefit. Even though the premium paid by the employer is the same, because of the relative risk score for the populations for the PEBB and SEBB programs, it's the PEBB program being a little more risky to insure for long-term disability meant that the $210 didn't go as far as it does in the SEBB program, which allowed that same $2.10 per month premium paid for by the employer is enough to secure a $400 a month maximum benefit. So a little bit of differences there on the long-term disability and some differences there on the dental, everything else aside from medical being an identical benefit. So when we are thinking about a consolidated benefits portfolio, a lot of that's going to be contingent on what the ultimate risk rating is and what the costs are, and then what the plans are that will be put forward by the different carriers and the bids they will put forward, the plan designs they will put forward, and what that new consolidated board would approve and want to see in plan designs. Some of the anticipated benefits of having a single non-Medicare portfolio are that the contracts for medical can be better leveraged for the services covering both populations. The assumption being that having more of a population to purchase for under one contract will allow us greater leverage in being able to leverage that size and the ability to have that much of the market influence in leveraging for the services for the populations. And then also having the single portfolio of medical plans creates some ease in administration, also helps to reduce a lot of the confusion that exists for what are referred to as dual enrollees or dual eligible people who have eligibility in both of the programs because they're dependent in either one or either, and an employee or one and either, one or both, as well as anticipating an increased availability of more plans throughout the state for more of the population. We noted that there are 17 plans available in the SEBB program, and so there are more plans available throughout the state in the different counties in the SEBB program, and we anticipate being able to leverage the consolidated program to offer a similar number, if not, keeping the same number, offering more plans in more counties without the state, which would largely benefit the PEBB population, but could also benefit the SEBB population, is that greater population may incentivize more of the networks to offer more plans in different counties. The single portfolio will be beneficial in that it will allow us to have a unified uniform dental plan. Again, that's our self-insured plan. One set of UMP, our uniform medical plan, which is also our self-insured medical plan, as well as a single portfolio of Kaiser and Primera plans available to the populations in the different counties. And without going into too many more details, but we will be providing some financial insights regarding the employer medical contribution, or the EMC, which is used for determining the premiums that are paid by the employee. There's a EMC that is set after the funding, subset to the funding rate that the legislature assigns during the budget every year. And the EMC is the portion that is then determined to use to cover the cost for the employer portion of the benefits that are made available to employees. And that's then what's used to offset the total premium, resulting in what becomes the employee. I think I might have said it wrong. The EMC is the employer contribution to the premium, which offsets the total cost of the premium, which then leaves the portion of premium that the employee pays. And typically that's about an 85-15% split. And that's based on the uniform dental plan, or uniform medical plan. And then that is applied outward to the different plans. And you can see the different premiums that range from that. Also, there would be some tier ratio alignment. In the SEBB program, it's statutorily required that the premiums difference between a full family coverage and individual coverage be no greater than 3-to-1. So if the individual premium for an employee is $50, then by statute, the premium for a full family can't exceed $150. In the PEBB program, it's a little different. It comes out to be about a 1 to 2.75 ratio between the individual and full family coverage. So the premium there between individual and full family doesn't quite follow the same sort of tier ratio. And so it would have to be determined by the legislature what the tier ratio they would want to have used, or if there's a different methodology that they might want to use. So with that, we'll move into the last part of what we have in this presentation, which is just a brief discussion about the stakeholder engagement and the feedback process. We have already presented this to the PEBB and SEBB boards as of last week, and we're able to solicit feedback from them. And then we have started with our stakeholder engagement process here on the 18th, presenting to a large group of stakeholders, with the primary emphasis being of us presenting and for the population to be able to ask any questions that they have of us. Then we'll be doing additional meetings until throughout the rest of this month and into next month, in which we will be using existing stakeholder meetings in order to continue to answer questions. However, any of the feedback that any of the stakeholder populations have, we are asking that it's submitted in writing to us. And we have it set the date of August 16th as the deadline for that information the feedback to be sent to us. That feedback is to be sent to myself, Cade Walker. That's cade.walker@hca.wa.gov. I apologize, it's not in the slide. I should probably have gotten it in there, but we're trying to get this thing recorded and out the door. So whoops, didn't get it on there. But it is on the last slide, and I will put it there. I'll leave it up at the end of the presentation here. And specific for the feedback that we're getting, there's a lot of components of consolidation that weren't necessarily brought into this report, that wasn't asked of it. We're being very diligent in providing the report that has been asked of us by the legislature, but there are still other components of consolidation that require some consideration. A big one that we know that hasn't been addressed in this, that we aren't addressing in this, is bargaining. I think there is some questions about what bargaining would look like with the consolidated board, and there, I think, is further conversations with labor that would need to be had in order to understand what consolidation would do in terms of bargaining. We are not addressing that in this report, and so that's just an example of some of the areas that are outside of the call of the question the legislature has for this report. So we're asking for the feedback that we received to please focus on these 4 areas at least, and then any other feedback you have, please include in addition. But please be, if you will have a section that provides feedback on the single board governing structure, the single risk pool for active employees and non-Medicare retirees, the structure that we've presented for maintaining eligibility for all active employees, and the single portfolio of benefits. And so we would ask that your feedback please relate to those 4 areas. And then if there's other feedback, please include it at the end of that for us to consider for the rest of this report. And then as that final reminder, we'd ask that is due back to me by August 16th. Though our legislative report is due December 1st, you'd think, well, that's quite a bit of time in between there. Why can't we get information back to you later? Well, that's because the review process is pretty lengthy. Our draft report is due mid-September for our internal review process that then will leave my shop's hands and go through the internal review process before then it goes up to the governor's office and the Office of Financial Management for their review and approval and any feedback and changes that need to be made throughout the month of November for us to meet our December 1st timeline. So we're asking for that feedback by the 16th based on the information that we provided in this presentation. And with that, if there are any questions that you have and after reviewing this recorded presentation, please feel free to reach out to me. My email there is below. And also for any feedback that you have, please submit that feedback to me again no later than August 16th to the email listed here, k.walker@hca.wa.gov. And with that, that concludes this presentation. Thank you very much, and I look forward to your feedback.